know run along the ribs. The intercostal nerves are right next to that. You see those? The nerves in the forearm and along the shoulder area, collectively they come together in called the brachial plexus. And hopefully remember that from Dr. Alderson talking about the brachial plexus. In your book there you see the brachial plexus. They have used a halo to kind of encircle those nerves to indicate the whole thing is brachial plexus. You should try to do something similar to that in your PowerPoint so that it's indicative of the fact that it's the whole set of nerves, which is the brachial plexus. Okay? What you're going to need to do is the sternomastoid muscle that's here in the cleidocervicalis muscle, you kind of have to move it away, and then basically there's going to be fascia and fat in between this body wall. Just kind of get rid of it, and you're going to see a collection of nerves. Okay? The external jugular vein here should be your guide. It's going to help you to discern which nerves are which. You notice in your book they don't even go over these nerves here, but we are going to. And that's what this handy, very poorly copied picture is for. Okay? You can see with this external jugular we have something called a suprascapular nerve. Supra means what? Above. So this would be intervening above the scapula, and then just caudal to that is the subscapular nerve. Now think of it this way. If we have the external jugular vein, think of the suprascapular nerve as supra to the external jugular vein, and the sub to the external jugular vein. Okay? Does that make sense? So suprascapular, subscapular. And then as we move into the arm, I want to make sure that you guys can get good visualization of these nerves. So when you have already probably opened it fairly far, I want to make sure you open that down all the way to the elbow so you can see all of the nerves as they head down the elbow. Okay? You're going to have to get rid of all of the fascia and fat that's up here. And when you identify these nerves, identify them in the distal part, because in the brachial plexus they're all conglomerated together and it's hard to see them. So make sure you look at them down further. So the first one we're going to look at is the axillary nerve. So find your axillary vein and artery, and it innervates right next to it. Axillary nerve. Okay? The next nerve is the one people are most likely to destroy during this process. And it's the first or most cranial one on your sheet. It's called the musculocutaneous nerve. Okay? And it has two sections to it. You guys see that? And it's like that in your text. It's in your book as well, or on the pamphlet. Okay? Musculocutaneous is the most cranial. It's the thinnest. And it has two branches. Okay? Once again, most cranial, thinnest with two branches. And then you go to the largest nerve, which is the radial nerve. You guys see that radial nerve in there? Largest, thickest nerve.